Everyone, I'm Dr. Becca Boronat, a veterinarian with the National Shelter Medicine team with Best Friends Animal Society. Today we're going to be talking really quick about medical and behavior holds in animal shelters. As veterinarians and medical teams in shelters, our goal is to provide effective care while promoting the fastest and best outcome for our animals. However, policies such as medical and behavior holds can sometimes lead to unintended consequences that impact life-saving, animal welfare, and shelter staff. Medical holds are often placed for conditions that are more effectively managed in a home environment. While these holds are intended to allow for treatment and recovery, extended shelter stays can contribute to increased stress and exposure to infectious disease. Research on feline upper respiratory tract disease has shown that the probability of a cat developing the disease raises from 26% by week 1 to 80% by week 2, highlighting the correlation between longer shelter stays and higher disease risk. And it becomes a vicious cycle, as you can see here. The longer they stay, the increased is the need for medical care, the decreased is the likelihood of adoptions, and that is delaying outcomes. And with that increases the probability of them having poor welfare in the shelter, overcrowding, that contributes to longer stays, and so on. Similarly, behavior holds may not always serve their intended purpose. Think about an animal that is arriving in a shelter, a place that he has never been before. Different smells, noises, people, the confinement, unpredictable routine, everything is new. And in this case, new is scary. And because of the arousal and stress levels, behavior assessments are less reliable and do not predict how an animal will behave in a home setting. A 2016 study revealed that behavior assessments are likely to result in a disproportionate number of false positives. Dogs that are aggressive during an assessment, but not in a home. Additionally, research indicates that stress level in shelter dogs often increase over time, leading to behavior deterioration and health issues. A study on the characteristics and welfare of long-term shelter dogs found that these dogs were more frequently described as exhibiting behavior problems related to aggression and high arousal. In summary, if we want to help these dogs and save their lives, we must get them out of the shelter as soon as possible, so they are in a home living the life they deserve. In addition to the effects on individual animals, extended holds can contribute to shelter overcrowding. When animals remain in care for prolonged periods, it reduces space for new arrivals and may increase the risk of disease transmission. Research on shelter management strategies, such as capacity for care, has demonstrated that proactive population management can lead to improved outcomes. Shelter implementing capacity for care reported a 31% reduction in length of stay, an 84% decrease in animals on isolation, and increased adoption rates. Prioritizing timely placement strategies can help mitigate these challenges. Many medical conditions are better managed outside of the shelter, and behavior concerns influenced by shelter environment will improve in a home setting. Transparent communication with adopters, fosters, and rescue partners, along with support for medical and behavior management, can facilitate successful placement while maintaining animals. And shelters function most effectively as temporary waypoints rather than long-term housing. By minimizing medical and behavior holds and focusing on timely placement of our animals, shelters can support positive outcomes, reduce disease risk, and enhance overall welfare. Save more lives today by removing unnecessary holds, which are not only overwhelming for your staff, but potentially increasing disease, stress, and contributing to a negative welfare in your shelters. Feel free to reach out to us. We are the National Shelter Medicine team with Best Friends Animal Society. If you have questions about this presentation or any type of questions about shelter medicine, reach out to us at sheltermedicine@bestfriends.org. And on this QR code on your right, you have access to medical protocols, and on the left one, you can request for medical assistance. Just reach out to us. Thank you.